My name's Kyle Javier. I'm the director and founder of Tiny Blessings. I am 32 years old and I am born and raised in California. I started Tiny Blessings in 2018. It was only like my second time being here in the Philippines. I came and moved here to reach out and to do something, and with the intention to start something which I later would discover is Tiny Blessings. So here we are in Tiny Blessings. It's like a 3-story facility that we have right now. We have a total of 7 different classes going on throughout the day, every day. We have a total of 60 students at this time. Some of those are only part-time students that they do some tutorial in the evening, or we have a youth program during the weekends. And a majority of those, about 40 of them, are full-time students. So they have 4 to 6 hours of classes here with a certified teacher in one of our 3 classrooms. And we also right now have 11 residents that live here. Those particular residents come from different family situations, but mostly single parent situations that they're struggling with addiction or they're in jail. So the children have been put into our custody and they're with us, 24/7. So Jennifer was one of our teenage students before. She was part-time in our education program, but she had a really hard time with attendance, coming to class on time, coming to class at all. So she dropped out of our education program. And around that time, family had discovered that she had tuberculosis. We were informed that she had started taking the medicine, but then a couple months later, it had been reported to me that she stopped taking the medicine. I went and talked to her, and her reason was that she started feeling strong again, and the medicine is so terrible to take. She thought it was okay that she stopped because she was regaining strength. We tried to explain to her, you need to do the whole segment, the whole series, otherwise, it doesn't work properly. So again, another few months later, people started to report to me, did you hear about Jennifer? She got possessed. She's possessed by a spirit, and she's going crazy. She was not coherent. She kept saying random things. She was randomly laughing and then crying. So I said, we need to take her to a hospital. I had talked to a friend in New York who is a doctor and explained to them, this is what happened. And they said, what sounds like what happened, the girl stopped taking the medicine, her tuberculosis moved into her brain and could be now affecting her brain functions. They had her in confinement for 3 weeks until she died. That was the first time that we had learned about tuberculosis, or that I had encountered it or even heard about it. So when that happened, I was like, how can you check for tuberculosis? How can we see, how can we figure out if anybody else has tuberculosis? People started to reach out to say you can do an x-ray. Ram from the TDF clinic reached out to us and said that he wanted to help us get x-rays. He knew the TBpeople that could, help us sponsor the screenings. So here we are trying to make sure that we can stop what happened to happen to any other of our students.
Ako po si Ram Cruel, mula po sa Tropical Disease Foundation. Under po ako ng EPIC project sa HIV program. Ako po ay case manager. Yung Tiny Blessing po, yung director nila is a friend. And then nag-reach out po siya sa isang post sa Instagram na meron pong mga estudyante sila na 34 na bata na kailangan magpa-test for TB. I reached out to Miss Abby kung pwede po natin silang matulungan. Ma'am Abby apparently reached out to TBpeople. And then sobrang grateful po ng Tiny Blessings and TDF as well na nandyan po yung TBpeople to assist yung 34 na mga bata, street children na nangangailangan po ng x-ray and then gamutan po and check-up na rin sa doktor.
Ako po si Abigail Dalus, pharmacist po ako. Working po ako dito sa TBF for 10 years. Sir Kyle daw ng Tiny Blessings, may mga kids sila doon na mukhang may symptoms and yung iba daw nag-undergo ng treatment. Naisip ko agad po yung TBpeople kasi nga TBpeople ay tumutulong sa amin para ma-x-ray po yung mga household contact ng mga ongoing TB patient namin. So from there po, naisip ko agad si Ma'am Danica, ayun, na-approve naman po ng ng TBpeople natin na ma-x-ray po yung mga bata.
Hi, I'm Danica Duran, TBpeople staff. Usually, nakaka-receive kami ng 3 to 5 x-ray per month. So, nung na-receive ko yung request na 32 children ang kailangan ng free x-rays, nagulat ako kasi ang dami. So, nag-decide ang TBpeople admin na i-cover lahat ng 62 na bata at kasama mga teachers sa Tiny Blessings Foundation para masiguradong lahat ng estudyante dito at pati mga teachers ay ma-screen.
I'm tasked within the TBpeople organization to create vouchers for x-ray. And sobrang nakakatawa na isipin, no, after we launched it this year, na sobrang marami na kaming natutulungan. TBpeople admin sent me an initial list of 32 names for me to create a voucher. And then just a couple of minutes, nag-decide na yung TBpeople admin na to screen the whole facility. And that resulted to a total of 62 vouchers. Sobrang nakakagulat kasi kailangan matapos na siya kaagad kasi syempre the urgency is there.
Rolin J. Martin Veto, ang TB physician for Tropical Disease Foundation. So when the case of from Tiny Blessings actually was brought to our attention, there were about 8 cases living in this common living arrangement. The more people share that same enclosed space, then the more people would be at risk for contracting the disease. There would be new children coming in or being brought to the shelter with no support or monitoring system in place to monitor these children. Unfortunately, there's no way for them to know who among these children who are potentially infected.
Ako po si Manny Directo. Employed po ako ng Tropical Disease Foundation. Pagbaba ko galing sa 3rd floor, nakita ko na maraming bata rito. Nakita ko dun sa pangalan ng wanap na papel, TBpeople. Kaya yun sabi ko, ano yata si Mamabi. Na nakakatuwa sila na marami akong nakitang bata na nakapila, na marami pang matutulungan ng TDF sa partner ng TBpeople.
So to date, we have actually attended or provided service to beneficiaries from Tiny Blessings, and this is thanks actually with the help of TBpeople Philippines. So Tropical Disease Foundation, we're honored to partner with them to be able to help these children as well as the people providing care to these children.
So dito po sa TDF, we do x-ray na po for the patient and syempre po kung may mga findings, we do screening din po. So sa screening, meron po siyang patient interview. And then we do the sputum test for the patient. And kung sakali po na eligible sila for treatment, we can also do the treatment here or we can refer them to the nearest health center kung saan po mas convenient sa kanila.
Hi, I'm Jano Balde. I am the officer in charge for the TDF One Stop Shop project. So, I'll give you a tour to dun sa aming AI or aming X-ray department. So, ang capability ng aming X-ray services is within the day or less than, actually, seconds lang yung binibilang, meron na kami kagad na wet reading. So, this guides us kung ano yung mga next moves namin. Then, yung results namin within the day then, this is interpreted by our radiologist. So, the fastest is within 1 hour, pwede na kami makakuha ng results sa kanya. Then from there, mabilis namin na sikaso kagad yung patient. If we have to do sputum testings like GeneXpert or other sputum tests, then the sputum test, mostly within 24 hours, we have a result, then we can start treatment.
Most all barangay health centers offer TB dots for free to the community. So if you or somebody that you know do have tuberculosis, they have those drugs available to help you treat it.
There are a lot of available services which are free of charge to patients, particularly for tuberculosis. Unfortunately, that comes with notion that if a service is free, then the service must not be that good of quality. So, but I would like to be able to reassure the community that these services are of high quality, and these are quality of international standards. Usually these are located at the local health centers or rural health unit.
Hi, Sir Kyle. On behalf of TB People Philippines, we'd like to give you a month's supply of vitamins po.
Thank you! Thank you po!
Ako po si Christian J.D. Ibanez. Ako po ay ang kanilang Education Program Director ng Tiny Blessings Foundation. So, sobrang nagpapasalamat po kami na nagkaroon po ng ganitong proyekto sapagkat bilang isang guro po, naniniwala ako na nakakaapekto sa kung paano sila mag-perform sa klase ang mga kabataan o mga estudyante namin kung naapektuhan ng kanilang mga kalusugan.
So, once again, Tropical Disease Foundation is very fortunate and very thankful to be able to work with Tiny Blessings, and especially with the support of TBpeople Philippines to be able to provide care.
I'm Glenn, nurse from Tropical Disease Foundation. With a collaboration with TDF and TBpeople, malaki yung impact na nagagawa sa community.
Ako po si Bago Baliwagan. Nawa po ay marami po kayong matulungan saan po dito sa Pilipinas.
Go!
Thank you, TBpeople!
At Tiny Blessings, you know, we like to make sure that we integrate everyone, we're inclusive, we have our children with disabilities mixed in with all of our other kids, you know? And we think that's really important in really being able to reach the full potential of everybody. We have several kids who have been diagnosed with ADHD, and this whole part of screening is really gonna help us ensure that they don't have a secondary disability. Me, I have ADHD. I grew up with ADHD. We knew I had it since I was like 5 years old. So I know that it's something that requires a lot more of attention and a lot more patience from your teachers and parents and mentors. We have been able to see incredible success with not just our residents, with all of our students, but with our residents in particular, we're seeing like accelerating through grade levels, moving through their academics at incredible speeds. I couldn't be more proud and more humbled and honored to be a part of their lives, because I can see in every single one of our kids that they have so much potential and they have so much drive, and they just have such bright futures. I really believe them to be the future of this country. So our hope now with our new partnerships, especially with TBpeople, that we can help to bring awareness, not only so that we can help save other children from our community and from Tiny Blessings from, you know, having to battle this disease sometimes when it's too late to. So we really hope that we can catch some of these cases and do preventative work, but also inspire other people, inspire other organizations, inspire other communities, so that you guys can do preventative work, so that you can do your efforts to make sure to check yourself, check your kids, check your family, check your community, to make sure that you can capture those things before it's too late. We really truly believe that every child has so much potential, and with just the tiniest bit of extra effort, it can go so far.